Good day, I'm Krista Naka from BSN Allergy of Tango Doctors College Incorporated, and for today's video, I'm going to demonstrate the medical hand washing technique. So the medical hand washing technique helps to prevent the growth and spread of pathogenic microorganisms from individual or environment to another. So medical hand washing is usually done at the start and end of the shift, before doing an invasive procedure, before being in contact with susceptible patient, before and after having a prolonged contact with the patients, when handling their article, their dressing, as well as their equipment used in this care, and also after having a contact with the body surface, even when you're using your gloves. So medical hand washing is usually done at the start and end of the shift, before doing an invasive procedure, before being in contact with susceptible patient, before and after having a prolonged contact with the patients, when handling their article, their dressing, as well as their equipment used in this care, and also after having a contact with the body surface, even when you're using your gloves. For this procedure, we will be needing soap. It could be a bar soap or a liquid soap, and it is preferable to use an antimicrobial or antibacterial soap. And also, we will be needing a tap or lukewarm running water for rinsing. And also, we will be using paper towels or single cloth or towels for cleaning and drying our hands. So here, I have my bar soap. So I will be utilizing this since this is the only available in the house. It is hygienics and it is germicidal soap, and also we have here the kitchen sink. So by preparing ahead of time these necessary materials, we will save our time and it is convenient for us. Next, we will be assessing our hands. It is important that we don't wear any jewelries, as microorganisms can lodge in the jewelries. Nails should also be short, as short nails are less likely to harbor microorganisms, scratch the patient, and or puncture gloves. Next, stand in front of the sink and keep your hands as well as your uniform away from the sink to prevent contamination. Uniform can harbor microbes when it's damp, which leads to the contamination of the uniform. So turn on the water. There are different types of faucets, such as hand-operated handles, knee lever, foot pedals, and elbow control. So for today, I will be utilizing, obviously, the hand-operated faucets, since this is the only type of faucet available in this house. Regulate the flow of the water so that the temperature is warm. Warm water can remove the microorganisms effectively and removes less of the protective oil. So remember to not splash the water into your uniform, as it leads to contamination, as moisture breeds microorganisms. Now, wet the hands and the wrist thoroughly to rinse microorganisms and dirt into the sink. Wet it by holding them under the elbow so that the water can flow from the wrist down to the fingertips. It is important that the water runs from the least to most contaminated area. After washing your hands and wrist, apply soap. Make sure to cover all areas with the soap and rub it vigorously. Rub soap firmly between the hands to remove its outer layer, as it has microorganisms. Remember to rinse the bar soap before returning it. Again, rub your hands to wash it and wash it thoroughly. To facilitate the removal of the microorganisms, this friction must be thorough, such as rubbing palm to palm. right palm over left dorsum and vice versa. Interlace. And palm to palm, again finger interlace. Back of fingers to opposing palm with finger interlock. And rational rubbing backwards of right thumb, claps in left and vice versa. And lastly, rationally rubbing backwards and forwards with clasped fingers of right hand in the left palm and vice versa in circular motion. And rinse your hands and face thoroughly and make sure that your hands are down and elbows up to prevent the microbes rinse off from the most contaminated part to the least. Now, pat your hands dry off thoroughly. Make sure that you don't rub the paper towels to avoid skin irritation. Now, discard the paper towel in the right container to prevent the transfer of microorganisms. So now, we're going to off the faucet according to the faucet control. So since I'm using the hand-operated faucet, I'm going to use again a paper towel to turn it off. To prevent contamination, of course. And again, discard the paper towel to prevent the transfer of microorganisms in the right container.
And now, your hands are clean, and the risk of having microorganisms is reduced. But remember, if you touch the sink, make sure to repeat again the procedure. And that is the medical hand washing technique. Thank you for watching.